Hi guys. So I received a lot, a lot of tips, information. Doctors reached out, people reached out, and I gotta stop crying because it's good. So I collected as much as I can all the information that I received. It's not everything. It's a lot. What to test, what to do from all the doctors and all the people also in the comment section and the community and people who went through MS symptoms as well and other things. So I'm gonna share everything that I have now, since my eye is still affected because of the MS symptoms and a lot of different things, but I'm gonna say that in the end after I'm telling all the tips, so you can share it with people who may be going through the same thing, to test it out, to do something about it. And I hope it will help somebody, because I for now did not find a solution, but I'm working on it. So let's start. I'm trying my best here because I'm feeling a little bit nauseous, sick, because of the vision to read that. But so I wrote a lot with Chafee, so I can tell you from his perspective what to do here. MS damages your nerves. This can take time to manifest. The symptoms onset can be delayed. He recommends to go 100% lion. That means 2 grams of fat to 1 gram of protein. Far too much of 1B vitamin, which was also the case with me, can give you a relative deficiency in others, which can cause problems. This was also an advice that Dr. Epps gave to my friend Mark. So it comes to the same conclusion with the vitamins. It's better to have a few ounces of liver 3 days a week. That will keep everything in balance. This applies to sick people. Testing blood work. I asked also what to test, and I'm gonna discuss that on Wednesday with my doctor. Some things got already tested. Is to test for vitamin A, C, B2, omega D, B12, B1, RBC, thiamine, folate. It's not very accurate to test the serum folate. You need to test the red blood cells level of folate, and not all labs will do so. So all the testing things I'm researching, because it's not that easy as you might think to get that hands-on. I also can tell you from my own experience, because I worked with a lot of startups and new companies, it's a lot of money-making bullshit that's going on, and they're faking all the tests just to make a lot of money. This is why I'm so careful with all supplements and these testing things, and I try as much to go natural as it's possible, because I too much see people faking these things and putting it on the market, and yeah. So an MRI, of course, for new lesions in the optic nerve, which will be done end of December, because that's when we have the appointment. I can go and pay 310 euros to make it myself. It doesn't privately, so I will have it in a couple of days, but I can't be for a long period of time in the MRI. I will just puke right now with my situation, so I can't do anything about it right now. ACT was done. It showed no bleedings, but as people who know me, they messed up in the summer with my breast problems that I had, and the pain, and they messed up so bad that all the tests were wrong until they cut me open and saw what's happening. So, but later to that. I should have contact with my neurologist and an ophthalmologist. I'm so bad at pronouncing English words, so I'm sorry for that. The neurologist, for me, it's a very, I changed them a lot, and they're just wanting me to put on a mat, so I'm trying to find somebody that's open to other perspectives. But I have a friend, which is a family doctor, who has MS and who goes a different path. So I have somebody to exchange also the medical side of it, because she went a completely different road. So I am gonna meet up with her soon, maybe in December or January, because right now she has some other things to figure out. He's also putting a series on people who heal MS on a carnivore, and they already reached out to me, so I'm gonna fill out also the questions and these things and deliver everything I have. Steroids, so the cortisone that they gave me for 5 times, he said also probably a reasonable start, but then go lion as much as possible, which means beef, salt, water, lamb. But also from the vitamin D perspective, wild sardines for vitamin D, ideal supplements 10,000 a day would be great. The B12 should be up to 1,100 to 1,600 pg/ml. I'm now at 600 something. I was at almost 3,000 in August. It was tested the last time. Also, my vitamin D was about 2,800 or something, and everything dropped. Everything is basically down in the average range. Some people said, and that's a very possible theory, that because of my surgery, that the anesthetics may cause my body to get all the nutritions and just like starving me to death from the inside, which does make sense. It happens to people. I know people that had very bad issues with anesthetics, which showed the same way. So it does make sense. But also, it's still strange, the B12 drops with all the organs that I'm eating and all the things that I'm implementing, and I've also been lying. So he said it can be a malabsorption issue. It's also important to have a B complex or the liver, depending on what you eat. Richard Smith, also in Spain, said that kidneys are important, and the other doctor that approached me after he said that if I don't want to eat the kidneys, I can also get the Dow pills. I had kidneys the last couple of days. My mom made it in a lot of fat, and it actually tasted okay, so it didn't taste like urine. And a lot of older people eat it that way, so it's something. I can also tell you that after the cortisone, my body was craving liver, and I hate liver. It was craving liver like crazy. My body was really showing it needs something out of some nutrition that my body is just naturally showing up. It's not because I'm carnivore, it just happens, and I hate it normally, but my body was showing me what it's needed. So also very important, if your body goes completely out of system and everything just went crazy, all these things just are difficult to listen to your body, but try as much as possible. Your body will tell you in the end if you need something. He also said to get tested for pernicious anemia. It's another autoimmune issues. What the problem is with autoimmune issues, that you very likely have a lot of them. I also have Hashimoto, so if you have one, you have a lot of issues with autoimmune diseases. He thinks that autoimmune issues are not autoimmune issues, but in fact lectins, glyphosate, and other toxins attacking your organs and tissues, and your body mounting an immune response to them. The tissue is getting hit in a crossfire. The same thing is also what my doctor, who has also MS, said to me, that there is the barrier to the brain, which should protect us from all these toxins. Some toxins just go through, and her theory is basically hitting in the same thing, that it's causing the lesions and it's causing these kind of issues we are having with our nerve system. For example, glutamate, I don't know if the English words are the same. The salt, it's called Percosalt in Germany, in Austria. It's the salt that's used actually for meat. Also citrus acid, which you also use in food, in a lot of food actually, and a lot of vegan food, by the way. When she told me that, I was vegan at the time, and the amount of how many of these very, very, very bad things that just crosses this, from her theory, this barrier, are in so many vegan foods these days. So keep that in mind, no matter what you do. It doesn't matter if you're carnivore or not, or whatever you're doing. I tried so many things, so believe me when I'm saying to you, I'm doing my best I can and looking into everything, and you can see that also from the amount of information that I'm getting, that I'm looking into it. I'm just sharing this now without some of them looking into it also from the community. So these are the tips from the community. I didn't research firmly. I'm gonna do that as well in the next couple of days as soon as I can get my grip together. So organs, meat in general, should be heated as little as possible to keep the nutrition and the vitamins and everything in. Does make sense. The vitamin D light, somebody said UVB light, narrow band UVB 311 nm wavelength phototherapy device. Maybe a dermatologist prescription to have that. Did not look into it. Dr. Sarah Pugh, I'm also saying the last name's always wrong, is very educated in all the light therapy things. So as soon as I go this road, I will check with her as well and talk to her about what to do here, because of the vitamin D issues and things. Because as much as natural, as same, or everything that is just a device, no matter if it's a UV light for water, something, I just saw too many scams from people you would not even believe that there are scams. So this is why I just don't want to go this path, and I'm trying to use first all the more natural approaches. The medication side effects, somebody also mentioned that it can be stronger on the diet we are doing, and a ketogenic diet, because it's not been tested on this kind of diet that much. So it does make sense, because the amount of how much the side effects were hitting me from the cortisone and steroids are just insane. It made everything so much worse when it comes to everything else. My eyes got better, my right eye got better from the vision part, but everything else and the pain got worse. So it makes sense that something about that is affecting it. Many people wrote about DSMO, that it helped them. I looked a little bit into it, and also in the methylene blue. Some people are writing amazing things about it, that it helps. It's like you can also order it on Amazon, so that this is nothing you need a doctor for, a prescription. But some also wrote very dangerous things about it and what happened to them taking it. So I don't want to go this path and add something else to the issues that I'm having right now. Somebody recommended testing the stomach acid, which is, there's also a lot of people recommended over the year that I'm doing this, sharing this. It's the B carb of soda and water on an empty stomach, and the longer it takes you to burp, the less stronger your stomach acid is. They were also saying testing for MTHFR gene mutation of MS. A book called Dirty Genes. Didn't look into these things, but I'm sharing it, so maybe some of you have experience. You can share it in the comment section, maybe for some other people as well. Jing mushroom blend super feast can support adrenals as you're dealing down the cortisone. One of the most saddest stories, I'm so sorry that you went through that with your daughter, is to test also the NMO, neuromyelitis optica. It's a special blood test, also in an MRI as well, but you can do it with the blood test. I already reached out to some hospitals and clinics and labs who can do these tests. it's not that easy to get to these tests to see if this is the variation of MS, because her daughter was treated before MS, and that's why she died actually. So I'm so sorry for that. And a lot of people were sharing that the parasites, to be tested for parasites and mold and these kind of things. This is just the common, and the oxalates and the histamine and the meat and not meat, and eat that and eat this. So the every path and digital and stress and so on. So the basics, I would say. So these are the not basics that I shared, that so many people shared. So it's just a short thing. I also received a very long email, so thank you for that. It's just too much for me to read and to get into all of this. As soon as I'm more capable of, I will also share your information you send per email. I can't say how much I appreciate these things that I reach and I get from all of you. I hope it will help somebody that's going through the same thing, and some of these things help. So to what's happened in the last couple of days after my last video is that I went to my last cortisone injection. I talked to the neurologist there, awful human, stupid being. I never in my life think I talked to such a stupid doctor, because when they put me in the emergency room in the first place, they said to make a CT just to be sure that there is no bleeding or thrombosis, because if so, the cortisone can make me go worse. And at the time I denied it because I didn't want to spend more than 12 hours in the hospital again. It was horrible. It was horrible. And I'm in a very, very, very good country to have a very good medical system, but that was insane. There were people sitting there for over 12 hours with fever, old people who didn't get picked up, women crying because every touch did hurt them, people dropping on the floor because they couldn't breathe, so many of them after then diagnosed with corona and other infection diseases, and put together with people like old people with already lung problems, which I don't understand. There are so many waiting rooms. Why put all these people together where is a chance to get something else by putting them in the same room for 12 hours with no protection whatsoever? So this freaking medical system needs to change. It needs to change. So after the 5th cortisone, I got there already very weak, and I just dropped. I totally dropped. The pain was unbearable. It did not help. The pain got so much worse, and it's not just not having a vision, it's pain. It's actually horrible pain. And it feels like somebody's burning your eyes out. And it doesn't make sense like that. It just doesn't. So after the 5th, it didn't happen like usually it does, that it helps a little bit. It always helped, the cortisone. It did help. But this time it got worse. So I told her that, and she was just so stupid. She was like, yeah, but you have eye problems. I said, no, it started with my brain. The eye is just another side effect. You have all my medical records. Did you even look at it? But yeah, do you have pain in your head? No, or? I said, of course I have. I'm telling you that for days now. She's okay, that's strange. I said, why is that strange? I said that the doctor in the hospital told me to do the CT, and if it's that or this, that the cortisone can make it worse. Is that maybe what's happening? Does it maybe be something else, and it's not MS again, and you're again putting it into this stupid trash can, MS, and it's something completely different? And she looked at me She was like, oh, I'm not kidding. She said, oh, I didn't think of that. Just give me 5 minutes. And she went down, she organized the CT and said, you're gonna be delivered downstairs. So they took the wheelchair, which was horrible. It just triggered so much fear again. And they brought me down. The CT was done in 5 minutes. It was so quick. And then we waited for hours. And at the same time when I was there, they were putting me and waiting, and you were listening to these horrible people saying how much they hate their job and how much these people are what their leaders, whatever happened to the hospital, I don't know what's happening, but it seems like they're having some leader change and everybody's just frustrated. And she said they destroyed my wish to be helping people and so on. And they were saying all these things while I was sitting there. I was like, are you fucking kidding me? And then they were constantly like, oh, she doesn't have this documentation, I cannot take her in, because my boyfriend at the time had my purse, so they couldn't get me in. And I said, the neurologist who sent me here, she called you guys. Started crying there. At the same time, the guy next to me were dropping on the floor because he couldn't breathe. And I just moved. They didn't even move me. I moved with my legs, just spinning the wheelchair behind to get away from the guy who couldn't breathe and was coughing. So when you have cortisone, your immune system is dropping and getting lower. So everything, every even little cough can be a real big issue. So we're just chilling. Now we waited so long for the results, and the CT did show no bleedings and so on. So she gave me some pain meds. The pain meds are getting me through the day, but it's a cycle. The pain meds are causing more issues, but without it, it's horrible. It's horrible. And if I take it, it's okay. I can manage it, but I don't know what to do from here, because I work in IT and everything else. So watching, looking at my phone, or like reading and writing, my hands are affected again. I tried to take a walk with my son and my dog, and my legs were blocking again. Right now, just writing you this, guys, my hands started working again proper, which is just not fair. Fucking not fair. It just started with the eyes, it just went dark. It wouldn't be such a big issue if the pain wasn't that bad. And my nerve system is just burning my skin. It's coming in waves. It feels like somebody's just burning me and hitting me and putting a knife into my hands, and over and over and over. And it's so messed up. So for everybody who's going through this, you're not alone, but it doesn't help, I know that, but the more people share their experience, the more people get involved into this, and the more tips we are getting, and the more we can look into it, test things, go these roads, the more likely it's that there is something that's gonna help in the end. Because right now, sitting in a MS clinic, what the people were doing, they were treating all these people. There were so many young people there. Just looking at it is horrible. Just looking at these people sitting there, and they were just treating them with more medicine, more medicine, more medicine. They were constantly changing the infusions. Nobody asked anything. They didn't even do blood tests with them, as they didn't even test for the most common issues with B vitamins and issues that maybe would help them without all these horrible side effects. It wasn't just me. I think they changed the brand of the cortisone they were giving me. That's my theory that I'm having, because the woman next to me had similar issues. Constant sick, constant problems with everything. And so my vision got back, but not in that amount. As soon as I normal look at things on Saturday, we were driving with the car. I saw everything in miniature. Everything was like Lego small. Everything went into a slow motion. Time was not time anymore, because the vision was causing my brain to see things that are not there, probably. Reality got completely messed up. I had the feeling that I'm in a parallel universe. All these things, if you experience similar things, it comes from the medication. It comes from these stupid steroids. So if you think that you're going crazy, look at your medications as much as you can, because this is so messed up. It makes everything so much worse, but without it also you are in constant pain. So there is a cycle that you really hardly can go out, and I did as much as I can without it, without going to the hospital, until I couldn't see anymore. It went completely dark and the pain was unbearable. That's the time when I went to the hospital. I wouldn't even go. I didn't go now for a month when it started. So I waited until the last minute to get there, and it made everything else worse. She also said to me that most people don't take, or they don't give cortisone when it's with the eye, because it can go away in 2 months probably, and it will get better, but it doesn't come with these side issues that I'm having. So she said, when I asked her, why do you give me this then when it's causing me so much pain? And she said, because we don't know if it's gonna get better, so this is your best chance to get your vision back. We are not doing it as a joke. We are doing it because it helps people. I don't think this helps people. I think this messes people up. And it makes everything worse. Besides that, they should look into what is causing these things. And it's not a freaking MS. It's not an autoimmune issue that is causing these things. Something else is causing it. And it's so much more. And I'm so freaking sure that it is a small thing that can be easily fixed. Just nobody knows what it is. I have it in my guts. This is why I am taking every resources that I'm having and testing everything that I can. So hopefully something shows up that somebody who's going through the same thing can look into it, and maybe this fixes everything. So I don't feel good. I need to take some pain meds now because I'm feeling very sick, and I will share whatever comes as much as I can, just to help somebody. At least I can do that, because I can not do much more about my situation right now than to test and look into everything and take everything that I can that makes sense to me. And whatever you're experiencing or going through, and your stories, your comments can inspire people. So it's not just on this video, but on every video. So I know I have so much respect for people sharing their stories about their own selves or their family members and what happened to them. And I'm sorry that you went through that. I'm so sorry if you're going through this right now, also with your family members, because it's not fair. But believe me, one thing, this year was hell. It was really hell. but I know in my gut, and I know that my beliefs into God help me through that, because I know that with all this bullshit that's happening, something will show up and it will do some change. And if it's not for me, then hopefully for somebody else, but I know that in my gut. And I hope, I just hope that we're gonna figure this out sooner than later. And thank you for everyone who shared their everything. And